Female sexual health, anatomy and common doubts. Female external genitalia. A female's external genitalia may not be clearly visible, as it lies between thick fold of skin, vulva. Urinary opening, urethral orifice, is just in front of the vaginal opening to pass urine. Vagina is an opening for passage of sexual fluids, menstrual fluids, birth of baby, after pregnancy. It is very elastic, stretchy and muscular. The clitoris is a tiny, about the size of a small pea, structure hidden within the folds of the inner lips where they join. It is extremely sensitive to touch and when stimulated gently becomes firmer and slightly bigger. Its main role is for sexual pleasure. Anus is an opening between buttocks to defecate, pass stools. Just like different people have differently shaped hands and faces, the outer lips, clitoris and vagina may differ in size, shape and color from female to female. The female reproductive system consists of a pair of ovaries along with a pair of oviducts, uterus, cervix, vagina and the external genitalia located in the pelvic region. Vagina is made up of very stretchable muscle, which has lots of folds in the resting form and the length is approx. 4 centimeters. To accommodate the penis, the vagina can stretch up to 10 to 12 centimeters. Vagina doesn't have any secretory glands, but it has secretions from the cervical gland and Bartholin glands. These secretions help in lubrication during sexual intercourse. There are 2 ovaries on either side of the uterus. With the onset of puberty, the release of an ovum, called ovulation. Ovulation starts on or near 14 days after the first day of menstrual bleed. Ovulation occurs every month from the alternate ovary after reaching menarche age. Uterus, womb, is a muscular organ where a fertilized ovum is lodged and the fetus develops in case of pregnancy. The mouth opening of the uterus is called as cervix and the inner layer of uterus is called as endometrium. What is a hymen? 11 hymen is a very thin elastic membrane, partially covering the vaginal opening. It varies in shape, annular, crescentic, septate, etc. The hymen is often torn during the first coitus, intercourse. However, it can also be broken accidentally by vaginal tampon use, masturbation or due to vigorous exercise. In some women, hymen can persist even after sexual intercourse. These days hymen can be also reconstructed by surgeries, which is imperforate hymen. Normally the hymen has an opening, orifice, for the passage of menstrual blood. Rarely, when this opening is not present, then it is called as imperforate hymen. In this, the menstrual blood doesn't come out of vagina and the female, after reaching the menarche age, complains of absence menstruation. This is usually diagnosed by a doctor, gynecologist, and can be easily treated. Why to never put water inside the vagina or never wash the vagina from inside? The presence or absence of the hymen is not an accurate indicator of virginity or sexual experience. Vagina has self-cleaning mechanisms. Therefore, never wash the vagina from inside with water or any chemical, as it can wash away the good bacteria, lactobacillus, and disrupts the healthy vaginal pH. How to maintain female genital hygiene? If genital hygiene is not followed, then there are high chance of infections and diseases. These instructions to be followed to maintain genital hygiene: 1. Wash genitals from outside daily with water. Don't use any soap, antiseptic, deodorants or any chemical in the genital region. 2. Don't put water inside the vagina. The vagina doesn't need any special cleaning. Vagina cleans by itself. If these good microorganisms, bacteria, are washed away with water or anything, then there are high chances of growing bad bacteria. 3. While washing anus after defecation, shitting, wash it from front to back direction in a motion away from the vagina. To prevent infection spreading from anus to vagina. 4. Change underwear regularly, at least once a day, and avoid synthetic underwear. 5. Wash underwear carefully to make sure you wash off all the soap, detergent from it. 6. Dry underwear in the sun, as sunlight kills the germs. 7. Do not put any unclean, sharp-edged objects into the vagina. It may cause bleeding, injury, infection, etc. 8. Do not touch your genitals with dirty hands. Keep your nails short so you don't hurt yourself. 9. Don't put the powder in your underwear, but keep the genital area dry to avoid any fungal infection. 10. During the menses, use a sanitary napkin, pad, and change it every 6 to 8 hourly. What is healthy and unhealthy vaginal discharge? Normally, vagina cleans itself and there are cervical secretions also that could present as vaginal discharge. So, it is important to know how to differentiate healthy vaginal discharge with unhealthy discharge. Always consult a doctor in presence of unhealthy vaginal discharge for treatment. Healthy vaginal discharge, clear or whitish in color, a slight odor that is not strong smelling, can leave whitish, yellowish tint in underpants, changes in consistency throughout menstrual cycle. Mostly present during ovulation period, 10-17 days of a menstrual cycle, it can be also present. When a woman is sexually excited, unhealthy vaginal discharge may appear green, gray, yellow or cheesy white in color, may present with itching, may have a strong purulent smell, may look foamy or frothy, may be blood-stained hash, may be associated with fever, groin fungal infection. Itchy groin 12. Normally groin is not itchy. It starts itching mostly due to presence of fungal infection, dermatophytes, called tinea cruris. It is due to the accumulation of moisture due to wet undergarment or sweat. Ways to deal with it: 1. Wear loose underwear. If needed, then can avoid underwear for few days. 2. Keep the groin dry after the bath. Make sure to wear dry underwear only. 3. If needed, then remove pubic hair, so the medications can be applied easily and the groin remains dry for the longer duration. 4. Don't share a towel or undergarment or soap. 5. Use antifungal creams like clotrimazole, etc. 6. Feel free to consult a doctor. What are breasts? Breasts are made up of fat and glandular tissue, secretes milk. They are the most erotic and fascinating organs for boys and girls. Though males and females both have mammary glands, but only in females breasts develop in size and shape during puberty. Breasts have important role in feeding the newborn babies. Breast stimulation is also a part of the sexual act, as breast stimulation can arouse women and can help to achieve orgasm. Breast and lactation: breasts start producing milk, called lactation, after the delivery of the baby. Newborn babies are fed exclusively only on breast milk for the first 6 months of life. Milk production is a highly coordinated system between the nervous system and endocrine system of the body. Amount of milk production also depends on the sucking of breast nipple the baby. Nutritional status of the mother, physical activity and healthy lifestyle. Normally breasts secrete from 450 milliliters to 800 milliliters of milk after pregnancy. If a woman who never got pregnant women start lactating, then she must consult a doctor for further evaluation of the cause. It is advised to avoid losing weight rapidly after pregnancy, as it can interfere with lactation. Breast size in female breasts morphology changes with age and reproductive status. Breast size is small among teenage and old age, sags, less fat. Breast size depends on genes, nutrition, age, and body fat. Female breasts are one of the secondary sexual traits that attract male attention. People have a different perspective in preference for breast sizes. Few females may even undergo surgery to increase breast size through breast implants, silicone gel. These implants are also placed after the surgery of breast cancer, mastectomy. What are bras or brassiers? Women wear bras or brassiers to support their breasts. As a girl's breasts grow, she may need to get a different sized bra every couple of years, till her breasts have stopped growing. There is nothing unusual about this. Everyone grows at a different pace. A female needs to wear a bra when her breasts have grown enough to jiggle or bounce when she runs. A female feels more comfortable wearing a bra, especially if she goes for jogging or any sport. There are various styles and sizes of bra available. The right bra is one that supports the breasts like a second skin. A female should wear a bra that is neither too tight nor too loose, and preferably a cotton one. A woman should take off the bra at night to allow for proper blood circulation and so that she can breathe comfortably while sleeping.